Start the class. So today I'll be taking a class on antiviral drugs. So today we'll be seeing the non-retroviral. We can write in the chat box later. Okay, don't write now. When I ask only you can write. Lamish already written, no problem. But when I ask, you can put the your name and number in the chat box. Okay, so I'll be sharing the screen. Sorry. Can you see the slide and am I audible? Someone please respond.
Yes, ma'am.
Yes, okay. You can see the slides also. So we'll be seeing antiviral drugs. So today we'll be seeing the non-retroviral drugs. There are retroviral, antiretroviral drugs are also there, non-retroviral drugs. So you all know that viruses, they are just a brief introduction, ultimate expression of obligate intracellular parasites. And you know that it takes nutrition from host cell and also direct its metabolic machinery to synthesize new virus particles. And always the viral chemotherapy, it is somewhat difficult because sometimes it may we have to be careful that it should not interfere with the cellular metabolism. And one of the important stumbling block in the case of this antiviral therapy is that because when we diagnose the infection, already the viral replication would have come to its peak. So sometimes when the symptoms appear, the replication has already has gone to a great extent. So for that reason, whenever we are starting some antiviral drug, it has to be started in the early period. So the prophylactic will be ideal, or we have to start in the early period itself. So important antiviral drugs. This is non-retroviral. The herpes virus drugs. They are idosulin, acyclovir, valacyclovir, famciclovir, ganciclovir, valganciclovir, cidofovir, foscarnet, and anti-influenza drugs. Amantadine, rimantadine, oseltamivir, zanamivir. Then anti-hepatitis virus, non-selective antiviral drugs there. For hepatitis B, it is lamivudine, adifovir, dipivoxil, tenofovir. Hepatitis C, it is ribavirin and interferon alpha. So today we will be seeing the anti-herpes virus drugs and anti-influenza drugs, these two. So once again the names: edoxuridine, acyclovir, valacyclovir, famciclovir, ganciclovir, valganciclovir, cidofovir, foscarnet, and anti-influenza amantadine, rimantadine, oseltamivir, and zanamivir. So the anti-herpes virus drugs, they are mainly the herpes, that group it comes HSV1, herpes simplex 1, herpes simplex virus 2, varicella zoster, Epstein-Barr virus, and cytomegalovirus. So these drugs, they are effective against all these viruses. It is HSV1, 2, varicella zoster, Epstein-Barr, and cytomegalovirus. So we will see one by one the drugs. Number one, it is edoxuridine. Edoxuridine, it is the pyrimidine antimetabolite. But it has got low virus selectivity and high toxicity is there, so it is used only for topical treatment. That is, and it acts against the DNA virus, and it is herpes simplex keratitis. That is, so it is used only for the topical treatment, and also there is superficial dendritic keratitis. So that is the edoxuridine. And another analog, it is trifluridine. It is similar to edoxuridine, and it is useful in case of HSV1, 2, CMV, and other related virus. So that is edoxuridine. It is for the topical treatment. Now, the most important drug, it is the acyclovir. Acyclovir, this is what will happen when it come to HSV, that is herpes simplex, any herpes infected cell. acyclovir, once it enters the cell, what will happen? It actually takes the help of the viral thymidine kinase. So, herpes virus specific kinase, it will convert this into a monophosphate, acyclovir monophosphate. After that, our cellular kinases, it will convert to diphosphate and triphosphate. So, to the first monophosphate, it is by the viral kinase. Afterwards, by the cellular kinases to diphosphate and triphosphate. And this acyclovir triphosphate is the one that will be acting on the DNA of the virus, herpes virus DNA, and it will inhibit the DNA polymerase and it will cause chain termination. So that is the thus sorry. It actually inhibit the viral replication. So that is the acyclovir. So acyclovir first monophosphate, then diphosphate, triphosphate, then inhibit the virus DNA polymerase competitively. So again, once the same thing. So acyclovir, herpes virus specific thymidine kinase, it converts it into monophosphate. Then cellular kinases, it will convert it into di and triphosphate. So, and it incorporated in the viral DNA and stops lengthening of the DNA strand, and terminated DNA inhibits the DNA polymerase irreversibly. So, there will be, there is no DNA replication of the viral replication. Thus, it is effective in case of the herpes virus. And it is effective only against the herpes group of viruses. All the herpes HSV1, 2, varicella zoster, Epstein-Barr, and cytomegalovirus. It is mainly for herpes simplex and varicella zoster and Epstein-Barr virus. So that is about acyclovir. How it is given? It is given an oral dose of acyclovir, and it is widely distributed, and it attains good concentration in CSF also. So that is, it can be given orally. Then we will see what are the uses. Acyclovir, you would have heard of this in many conditions. It is used in case of genital herpes simplex, genital area, and there we can apply either topical or parenteral acyclovir we can use. Then if it is, it can be primary, late, or recurrent disease, that is genital herpes simplex. If it is primary disease, we can try topical treatment, but it may not be that effective. We have to go for oral or parenteral. Late cases anyway, it should be treated with oral therapy or in addition to local therapy. And the recurrent disease, it should be treated with parenteral. So we are talking about acyclovir uses genital herpes simplex. Now, another use is mucocutaneous herpes simplex. You would have seen such conditions in some patients, some small cluster of blisters like this. This is the lips only. So the corner of the lips, you will see some blisters like this. It is called mucocutaneous. It is actually produced by herpes simplex. Mucocutaneous herpes simplex. And here we can use acyclovir. Skin creams are there. So that is, we can apply over this. It is not that a fatal condition, but it will remain there for a week or two. So we can apply acyclovir skin cream. Then, if it is encephalitis, herpes simplex encephalitis, you know, it is very fatal condition. It is a very severe condition, a sickly condition. So, in such cases, you know that it should be given IV only, a parenteral drug. So, herpes simplex, encephalitis, and any antiviral therapy, if it is started in the early, it will be very effective. So, now, another use, already I have mentioned herpes simplex, that is edoxyridine, like this is also effective. Herpes simplex keratitis. Herpes simplex keratitis we can use. We have already mentioned edoxyridine. Similarly, we can apply this acyclovir IO ointment, and it has got good corneal penetration. So it is useful in case of herpes simplex keratitis, that is corneal. Then herpes zoster. So herpes zoster, the importance of herpes zoster is that always there will be a dermatomal distribution. So if you see, the patients will be telling it, there is a particular pattern. That is what is a dermatome? Dermatome is actually the area of the skin supplied by a single spinal nerve. So along the route of particular spinal nerve, there will be the blisters. So there is a pattern. It is not diffused. It is having a pattern. So that is the herpes zoster. And so such cases we can go for oral acyclovir, 800 milligram 5 times daily. But everything, it should be started early. So this is a herpes zoster. Then now chickenpox. Chickenpox, you know what is varicella zoster? Everyone knows what is chickenpox. These blisters will be this fluid-filled blisters, pustules will be there. So that is chickenpox. So here also it is one of the most important drug. And usually the acyclovir is given in immunocompromised patients when the immunity is less. But for prophylaxis, we can give. So suppose in any house, if there is a chicken box and we have some contact, then the susceptible contacts can take acyclovir 400 milligram 4 times daily for 7 days during the incubation period. It will abort the chicken box in the contact. And even in the case of chicken pox, in the early case, if you give oral acyclovir, it may be to some extent it will reduce the severity. As we say now, this remdesivir, if it is started in the early stage, it will reduce the severity of this COVID infections. So, like that. So, all the antiviral, it should be started in the early stage, then it will be having good efficacy, because after the replication of the virus, if we are giving the drug, it may not be effective. Now, what are the adverse effects when we are applying ointments, etc.? So there will be burning sensation. Orally, it is well tolerated. Then intravenous rashes can occur. Then falling BP also can occur in few patients. Then there may be sometimes renal problem, because there is a dose-dependent decrease in the glomerular filtration rate. This is the most important toxicity. It is not teratogenic, that is acyclovir. So that was about acyclovir. Then another drug, it is valacyclovir. Valacyclovir is actually, it is a prodrug of acyclovir, and it is having good oral, when it is taken orally, it is having good oral bioavailability. Valacyclovir, it is a ester prodrug, and it is the drug of choice in herpes zoster also. So acyclovir, valacyclovir, ester prodrug. Now, many drugs are there. Then famciclovir. So another drug, it is famciclovir. Then it is the ester prodrug of penciclovir. So this ester prodrug of penciclovir is famciclovir. And it is also effective in case of similar zoster. And sometimes it is effective against some activity against hepatitis B virus also. So acyclovir, valacyclovir, famciclovir, which is a ester prodrug of penciclovir. Then, so that was about the acyclovir and its analog and the prodrugs. Now, another group of drugs, there is drugs for cytomegalovirus. Cytomegalovirus, usually it causes infection, the changes in the retina, CMV retinitis. So, the one drug, it is ganciclovir. So all these drugs, its action is the same. It will be converted to first into triphosphate, and it will inhibit the DNA polymerase, and it will inhibit the DNA replication. So ganciclovir is also like that, but it is effective against cytomegalovirus. It can also inhibit the herpes simplex zoster and Epstein-Barr virus, but main action, it is cytomegalovirus. CMV means cytomegalovirus. So ganciclovir, it is effective for cytomegalovirus, but its toxicity, we can see it is having bone marrow suppression. Bone marrow suppression is there, and also neuropsychiatric disturbances. And so, that is one important toxicity, isn't it? Bone marrow suppression. Then it is a drug for CMV. It is for the prophylaxis as well as treatment of cytomegalovirus. So in cytomegalovirus infections, there may be pneumonitis, colitis. Mainly it is retinitis. So it occurs mainly in case of immunocompromised patients. Such cases, we can go for this ganciclovir. So that is the drug for cytomegalovirus. So this is the CMV retinitis on the retina. There is inflammation and all the changes. So another drug, it is valganciclovir. First one was ganciclovir. This is valganciclovir. It is a valale prodrug of ganciclovir. Again, it is used in case of CMV retinitis. And it is used for the long-term suppressive therapy of CMV retinitis and other CMV. So for CMV cytomegalovirus infection, we have ganciclovir and valganciclovir. Valganciclovir. Now, another drug for CMV as well as other HSV and pox and adenoviruses, it is called cidofovir. Cidofovir, one importance is that, one difference is that it is a monophosphate nucleotide analog of cytidine. Monophosphate analog. So because it is a monophosphate, does not require any viral phosphate. We have seen in the beginning the viral thymidine kinase will convert the acyclovir to acyclovir monophosphate. But cidofovir, it is a monophosphate. So it does not require viral phosphokinase. But it is in the body, in our host cell kinases, we will convert it into diphosphate, that is the cidofovir. And this is also effective in case of CMV retinitis. So ganciclovir, valganciclovir, and cidofovir, they are effective in case of CMV retinitis. And other uses also acyclovir resistant mucocutaneous herpes simplex, anogenital warts. So these conditions, it is mainly for CMV retinitis. And primary toxicity, it will be kidney damage. So for CMV retinitis, which are the drug? Ganciclovir, valganciclovir, valganciclovir, and cidofovir. But cidofovir specialties, it is there, monophosphate. So no need of any viral phosphokinase. Then another drug for again CMV, it is foscarnet. Here again, it is inhibiting the DNA polymerase, but it is also useful in case of HIV, that is because it is useful. It inhibits reverse transcriptase. This we will see later. So this is foscarnet, and it is mainly for CMV and also herpes simplex and other herpes group as well as HIV, because it is inhibiting reverse transcriptase enzymes also. That is foscarnet. So ganciclovir, valganciclovir, cidofovir, and foscarnet. Foscarnet, but certain its toxicity, it damages kidney and it produces renal diabetes-like condition. There will be hyperglycemia and also hypocalcemia. Renal diabetes-like condition and hypocalcemia. So these two important side effects. Foscarnet, renal diabetes-like condition, and it can cause hypocalcemia. So it is mainly for CMV retinitis and other CMV infections in AIDS. So ganciclovir, valganciclovir, cidofovir, and foscarnet. These are for CMV retinitis, and this foscarnet, it causes renal diabetes-like condition and hypocalcemia. Now coming to the, so we have seen the anti-herpes virus drugs. Now we are coming to anti-influenza virus drugs. So the influenza virus, there are influenza A is there, B is there, C is there. All these influenza virus drugs, they are RNA virus. Whereas herpes virus, it is a DNA virus. So the influenza virus, they are all RNA viruses. And most of the human infections, that is by the influenza, it is by influenza A. And in 1997 and 2000, when was it? 2009. Yes, 1997, you have heard of this bird flu, some of you. But in 2009, you would have heard of this swine flu, H1N1. And bird flu, it is H5N1. It was in 1997, that outbreak. And 2009, there was swine flu. It is H1N1. So these are all influenza virus. Now we will see the drugs that are effective against this influenza virus. Number one, it is amantadine. Amantadine, it was introduced in 1960. But this is effective only for influenza A virus. We have B, C as well as H5N1 and H1N1, etc. But amantadine A, it is effective only for influenza A virus. What is the mechanism of action? So whenever the virus enters the body, there will, first it enters and there will be uncoating of the virus. So the RNA has to come out. So this uncoating, it is mediated through a protein called M2 protein, M2. So this amantadine, it actually acts on this M2. It will inhibit the uncoating so that the virus, the RNA cannot come out. So it will inhibit the uncoating of the virus. So this is the influenza A virus. It will prevent the uncoating. So that is amantadine. But nowadays we have a lot of other antiviral drugs for influenza. So this was one of the very important drug. Previously it was used frequently, but now it is not much used. But this is one drug that is used in Parkinsonism also. We will come to that. But for Parkinsonism also, it is a CNS degenerative condition, and for that also, only very certain situations we are using this amantadine. Otherwise, but it is a drug for influenza A virus. Then another medial derivative of amantadine, it is called rimantadine, and it is longer acting and better tolerated. But rimantadine also, it is not used nowadays. Now, this is one important drug, oseltamivir. So now, during this COVID situation also, during this pandemic situation, you would have heard of this oseltamivir, and sanamivir, and paramivir. The many words are there. And remdesivir is, everyone knows remdesivir, but oseltamivir also we are starting giving in COVID patients. So this is one of the, previously it was only for the influenza virus, especially bird flu, that is H5N1, and H1N1, that is swine flu. So these two, this oseltamivir, it was effective in this case. So these are also influenza type viruses. So how in the body this oseltamivir, it will be converted to an active form called oseltamivir carboxylate with an oral bioavailability of 80%. So this is oseltamivir. It will be rapidly and nearly completely hydrolyzed during absorption in intestine and by liver traces to the active form oseltamivir carboxylate. So oseltamivir, it is converted to its active form, oseltamivir carboxylate. So that is the active form is the main thing that is effective against all this influenza virus, that is H5N1 and H1N1, etc. Okay, what is the mechanism? So again I am telling this the virus enters a cell, and so the uncoating, it is inhibited by the amantadine. After that, okay, if it is not inhibited, the RNA will come out. RNA will be going into the nucleus, and after that there will be a transcription, translation, etc. New progeny virions will be formed, and it will be released into the out of the cell of the host cell. So this release, that is budding and release, it is called. It is by one enzyme called neuraminidase enzyme. So this sanamivir and oseltamivir, it inhibit the neuraminidase enzyme. So viral replication would have happened. I mean, all the growth would have happened, but it is not released. The progeny virions are not released from the infected cell. So that is the viral neuraminidase inhibitor, oseltamivir. So then another related drug, it is sanamivir. Both everything, it is the same action, oseltamivir and sanamivir. And so it is the most effective drug for influenza A and H5N1, H1N1, as well as influenza B also, it is effective. And yes, as I have already mentioned, it should be started within few hours of the symptom onset. Reduce severity, duration, complications, etc. Any antiviral drug, it should be started in the beginning stage itself. Then it will be effective. Then in infants, this oseltamivir, it is not effective because I told you it should be converted to oseltamivir carboxylate, that is the active metabolite. So that is not happening in infants. So it is not effective in case of infants. Then if there is some swine flu outbreak, for a prophylaxis of therapy we can give. Therapy means for treatment, 75 milligram oral BD for 5 days, that is effective. Prophylaxis, we have to take 75 milligram OD for 5 days. So that is the oseltamivir. So some in 2009, later on, I think some 5 years back again, the swine flu came, and some people were taking this oseltamivir prophylaxis. Now, the drug, you would have heard of this drug, Tamiflu. It is nothing but it is the oseltamivir. And the side effects are nausea, abdominal pain, that is the gastric irritation. There is very less side effects only, Tamiflu. So it is a very important drug and it's a wanted drug. Then another neuromedicine field, same mechanism, Sanamivir. Sanamivir, but it is given as inhalation. It is available as powder. So it is given by inhalation. But as you know, when we are giving inhalation, it will be having some amount of side effects also because it is available in the powder form. So sometimes it can cause bronchospasm in some individuals. So it should not be given in patients having asthma. So it may produce some bronchos because it is available as a powder. That is Sanamivir. It is a neuraminidase inhibitor. And it is usually for all cases we are giving oseltamivir, but in oseltamivir resistant cases only we will go for this Sanamivir. So oseltamivir and Sanamivir. Now third drug, it is peramivir. So here it is the IV treatment, single dose IV treatment for influenza. And like others, it is effective against A, B, as well as bird flu and swine flu. Bird flu, it is H5N1. Swine flu, it is H1N1. Same mechanism, it will inhibit the viral neuraminidase enzyme. So three drugs, oseltamivir, zanamivir, and peramivir. These are all inhibitors of neuraminidase enzyme, and it is effective against influenza A, B, H5N1, and H1N1. And its side effects, it's only some diarrhea, nausea, vomiting, etc. These are all the usual complaints. Thank you. Did you understand? Yes or no?
Yes, ma'am.
Yes. So I can just close it and then I can ask some questions. Do you have any doubt or anything to be for clarification? Should I go back to the slides? Anyone needs any clarification or any doubt or something? This antiviral drug, it will be continued. It is not over. It's only anti-herpes and anti-influenza only is over. Again, it will be continued. 2-3 classes will be there. So now we are living in a situation where the pandemic, it is going on. So many antiviral drugs we have to see. So these are the original, the already existing antiviral drugs, and we have to see about the one that is coming out, the newly discovered, etc. So okay, so that is why there will be 2-3 classes. Okay, I think there is no doubt, so I will stop sharing. You can ask some questions. Now you can write in your chat box. Already 5 people have entered, but don't worry, no problem. Those who are present, now 88 people are there. Start writing your name and number in the chat box. This time, that is, what's the time? It is 2:31. So at 2:31, between 2:31 to 33, whoever have entered the attendance, I'll be giving you the attendance. Yes, those have ended. In the beginning also you can write again because yes. Okay. Hmm. Okay. 90. 86, 4. One more person. 92. Okay. 86. Fine. A minute. Why again and again? 93? How come? You want to write only once, not several times. Okay then. So I can ask some questions. Aisha Shaba, Aisha Shaba, Aisha. Hello.
Yes, ma'am.
Yes. Where did you go? Okay, where are you? Where are you, Aisha? Okay. Aisha, can you tell some drugs that is acting against herpes virus? Herpes virus, some drug name.
Idocertinib, acyclovir,
Idoxuridine. Idoxuridine or idoxuridine? Yes, acyclovir. Acyclovir,
then cidofovir,
which one?
ganciclovir,
Ganciclovir, it is against which virus? Mainly? Yes, correct. You are correct. I think you
megal, cytomegalovirus.
cytomegalovirus. Yes, correct. Okay, you're fine. Thank you. Sneha M. Surendran. Sneha. What is
Yes,
the
ma'am.
yes? What is the mechanism of action of this acyclovir? All drugs are having the same mechanism. So, what is the mechanism?
They inhibit the herpes virus.
No, you are. Where are you? Sneha. Yes. Okay. Tell me. Say loudly.
Ma'am, they inhibit the viral DNA polymerase.
No. Before that, what is happening to the drug? Acyclovir. What is happening to the drug? It will inhibit DNA polymerase. That is correct only. But before that, what is happening to the drug? I showed one picture also. No, what is happening there? Okay, you said the last point only. It inhibit the DNA polymerase and inhibit the viral replication, the DNA chain termination. Okay, Aishwarya N. Aishwarya.
Yes, ma'am.
Yes, Aishwarya. Can you tell me what happens to acyclovir when it enters the body, or what is the mechanism of action?
It first get converted into acyclovir monophosphate
Yes.
and then to acyclovir triphosphate. The acyclovir triphosphate inhibits DNA polymerase.
Yes, very good, very good. Okay, now, okay, you can close it. Then Srinesh. Srinesh, please respond. Srinesh, you are not responding, Srinesh. How come this are 95 people? Okay, no problem. Whom should I ask? Others K.
Yes, ma'am. Yes, ma'am.
Yes. Which are the drugs that are effective for CMV rhinitis? That is
ganciclovir.
Yes.
Valganciclovir.
Yes, very good.
Then cidofovir.
Okay. Then the last.
Forscarnet.
Very good. Forscarnet. Yes, very good. Very good. That is fine. Now, whom should I ask? 1 minute. Sanjeev Kumar.
Yes, ma'am.
So, can you tell one? Where are you, Sanjeev Kumar? Where did you go? Where are you?
Yes, ma'am.
Where are you now?
Yes, ma'am.
Yes, you are there. Okay. Can you name some drugs for influenza? Can you name one drug for influenza A virus?
Remantidine. Remantidine.
Remandidine. Okay, very good. Okay, now I will ask yes, Ashok Unnikrishnan. Ashok Unnikrishnan. You are not there?
Yes, ma'am.
Yes, you are there. Okay. Can you tell some drugs that are effective against influenza A, B, H5N1 and H1N1. Yes, one drug.
Oseltamivir.
Oseltamivir. Okay. No problem. Okay, you can close it. Alanda Fernandez. So he told it is oseltamivir. Any other drug? Oseltamivir, he told. Any other drug?
Zanamivir.
Zanamivir. Okay. Now you can close it. Adira Dilip. Any other drug? Adira Dilip. Any other drug? Oseltamivir, Zanamivir, and
Peramivir.
Peramivir. Okay, very good. Now Vishnu. Vishnu, are you there?
Yes, ma'am. Yes, ma'am.
What is the mechanism of action of all these oseltamivir, zanamivir, and peramivir? How does it act?
Oseltamivir in the body is converted to oseltamivir carboxylate, which inhibits neuraminidase enzyme.
Okay. Very good. Then whom should I ask? Ajnas. Yes, class representative Ajnas. Ajnas. Yes.
Ma'am.
So what does this neuraminidase, this enzyme do? What does it do to the virus? What is its action? Neuraminidase enzyme.
It releases the progeneurons from.
Yes. So it will not so this drugs, it will inhibit the neuraminidase enzyme and it will inhibit the release or the budding and release of the progeny virions. Okay, very good. Okay, then I think the class is over. All of you are written your name and number. Okay, then we are stopping it here. Okay, bye.
Thank you, ma'am.
Thank you, ma'am.